This video is going to go over oral liquid calculations. Okay. As always, I recommend looking at the end of the question first. Is the question asking? Is mils per dose. And then stop and ask yourself, what information do you need in order to answer that question? Well, I know that I need to know how much my doctor wants, and I need to know about my drug label concentration. So this is going to be a D over H times V calculation. So D, what's my doctor's order? Here I have both of these written in grams. So my doctor's order is 30 grams, and what do I have? I have 10 grams times 15 milliliters. Okay, so I'm going to go ahead, I'm going to march that out. I'm going to do 30 divided by 10 and multiply that by 15 milliliters, and I get 45. 45 what? 45 milliliters. I'm going to write that right on that line provided so the instructor knows that's my final answer, and I'm going to make sure I label that number, 45 milliliters per dose. Okay, next question, read the end first. How many units will you give per day? Okay, this is not a normal question. This is a little bit different. Units per day. What do I need to know to answer this question? Well, I don't need my drug label concentration. What I need to know is how many units per dose, and I need to know how many doses per day. So units per dose, that one is right here. My doctor wants 500,000 units. And how many doses per day? TID, I know that means 3 times a day. So 3 doses per day. So I'm going to multiply these together. So I'm going to go to my calculator and I'm going to type in all those zeros very carefully to make sure I put 500,000, and I'm going to multiply that by 3, and I get 1,500,000. So I'm going to write 1,500,000 units per day. Okay, units per day. That's why it's very important to make sure we read the end of the question first and stay on target for what we're trying to answer. Moving right along, next question, milligrams per day. Okay, kind of the same thing. I need to know how many milligrams per dose, and I need to know how many doses per day. So again, I am not really interested in this drug label for this question. How many milligrams per dose did the doctor order? And that's going to be 425. How many doses per day is TID? That means 3 times a day. So I'm going to multiply my 425 milligrams per dose times 3 doses per day, and I get 1,275 milligrams per day. Okay, scrolling right along. End of the question. Milliliters per dose. What do I need to know? Well, I need to know my doctor's order, and I need to know my drug concentration. This is going to be a D over H times V calculation. So what's my D? What's my doctor's order? 450 milligrams. Okay, what do I have? I have 300 milligrams times 5 milliliters. So I'm going to go to my calculator. Now I'm going to do 450 divided by 300 and multiply that by 5. What is my answer? My answer is 7.5 milliliters. Final answer. Okay, I'm going to read a little bit here. A patient required the maximum amount of this medication. How many milligrams? So how many milligrams max would they receive? How many milligrams max? Okay, so this medication is written Q4-PRN for fever. So I know that if I gave this medication every 4 hours because this patient's fever continued, how many times per day would I give it? So I give it every 4 hours. I'm going to take 24 and divide that by 4, and that's going to be 6 times per day max. Okay, if I gave it every 4 hours, I would be giving that 6 times a day. So if they required the maximum amount, how many milligrams? So what do I need to know? I need to know how many milligrams per dose and then how many doses per day. And I already calculated that I have 6 doses per day. How many milligrams per dose am I giving? It's 350. And I'm going to multiply, go to my calculator, multiply 350 times 6, and that's going to give me my max milligrams per day, which is going to be 2,100 milligrams per day. Okay. How many doses will the patient receive each day? How many doses per day? Okay. Well, again, I'm not interested in the label. I'm not even going to look at that. The doses per day is part of my doctor's order. How many doses per day? This question is asking me if I know what QID means, and I do. It means 4 doses per day. And I'm all happy because that's a nice easy one. Doses per day is 4. Okay. Mils for the loading dose. So some medications, we try to get the levels up in the blood. So we give a larger dose, which is called a loading dose first, and that's followed by what we call a maintenance dose. Okay. So in this case, this particular question is asking for the loading dose, how many milliliters would we give? And I know that I'm going to be looking at the loading dose information. So that's this one here. I'm going to need that doctor's order. And because I'm asking for milliliters, I'm also going to need my drug label concentration. So I know that this is going to be a D over H times V question. And I'm going to base it on my loading dose order. My loading dose is 500 milligrams. And then what do I have? I have 125 milligrams in 5 milliliters. Go to my calculator. 500 divided by 125. And I'm going to multiply that by 5, and I know that I have 20 milliliters for my loading dose. How many milligrams per day? Okay, what do I need to know that? Again, not the label. Milligrams per day. I need to know how many milligrams per dose, and I need to know how many doses per day. And I'm just going to go ahead and fill that in. How many milligrams am I giving per dose? It's 450. How many doses per day am I getting? BID. That means twice a day, 2 times a day. So I'm going to take 450, 450, and multiply that by 2, and I get 900 milligrams per day. Again, this is why it's really important to read the end of the question first to say, what do I need to know to answer that question? Okay, mils per dose, mils per dose. I'm going to need my doctor's order, and I'm going to need my drug label concentration. This is going to be a D over H times V calculation. My D is my doctor's order, 350 milligrams. And what do I have? I have 160 milligrams times 5 milliliters. Go to my calculator, 350 divided by 160 times 5. Oh, that's a crazy number. Equals 10.9375. That is not my final answer because I cannot give that volume to a patient. So I need to know I need to round to the nearest tenth. And in order to do that, I'm going to look at the number following that number. So I actually don't care about these numbers at all. Doesn't matter what they are. But because we have math rules for rounding, 3 is 4 or less. So I know I am not going to go up. So my final answer is going to be 10.9 milliliters. Okay? And if my answer was 10.96, this 6 is greater than 4, so then my answer would have been, well, 10.10, haha, now my answer would have been 11, right? Because there's no such thing as 10.10, and we would have to go up from that 9. Okay, so my answer would have been 11 if that was the case. But in this case, my answer is 10.9 milliliters. Just wanted to give you a little heads up on how to round. Okay, next question. How many mils would you give for each dose after the loading dose? Okay, mils for the maintenance dose. Now I know that this is not the dose I'm looking for. This is the one I'm looking for. I need to know that volume, and I also need to know my drug label concentration. And I know that this is going to be a D over H times V question. And in this case, my D, my maintenance dose order is 350 milligrams. And what do I have? I have 125 milligrams times 5 milliliters. Go to my calculator. 350 divided by 125 times 5 equals 14 milliliters. Okay. Mils per dose. Okay, what do I need to know? I need to know my doctor's order. I need to know my drug label concentration. This is another D over H times V calculation. My doctor's order is 925 milligrams. What do I have? Well, look, it's going to give me units. It's going to give me milligrams. But because my order's in milligrams, I'm going to use the milligrams here. So I'm going to say 250 milligrams times 5 milliliters. Okay, and I'm going to march that out. 925 divided by 250 multiplied by 5 equals 18.5 milliliters. Okay, doses per day. Boy, what do I need to know? I don't need to know anything about my drug label, so I'm not even going to look at that. Doses per day is this part of my doctor's order right there. This question is asking me if I know what TID means, and I do. It's 3 doses per day. Yay! Okay. End of the question first again. How many milligrams would you give each day for the maintenance dose? Milligrams for the maintenance dose. So I know I'm not worried about this. This is my maintenance dose right here. Milligrams for each day. Milligrams each day. What do I need to know? I need to know how many milligrams per dose, and I need to know how many doses per day in order to answer this question. And I know that I'm giving 350 milligrams per dose. How many doses a day am I giving? I'm giving it TID, so I know that that means 3 doses per day. So 350 times 3 equals 1050 milligrams per day. Okay. How many doses per day will be given? Nice. Again, not going to even look at that label and get confused. It's my doctor's order. How many times per day does the doctor want this medication? BID. What does BID means? It means 2 doses per day. Okay. How many max doses could you give per day? So what this question is asking is if this medication is every 4 hours whenever necessary, if they took this medication every 4 hours because they needed it, how many times could they get that possibly per day? And I know that there are 24 hours in a day. And if I divide 24 by every 4 hours, I get 6. 24 hours divided by every 4 hour, I would get 6 doses per day. Okay. And here's, okay, got a couple more. Question is asking me how many mils would I give for each dose? Mils per dose. I'm going to need my doctor's order. I'm going to need my drug label concentration. This is going to be a D over H times V calculation. My doctor's order is 425 milligrams. What do I have? I have 125 milligrams times 5 milliliters. Go to my calculator. 425 divided by 125 times 5 equals 17 milliliters. Last one. Okay. Question is asking me mils per dose. Again, mils per dose. I need to know my doctor's order. Whoops. I need to know my doctor's order, and I need to know my label concentration. D over H times V question. What's my doctor's order? 600 milligrams. I'm going to go to my label, and again, I see milligrams, I see units. My order is written in milligrams, so I'm going to use the milligrams. I'm going to write 250 milligrams in what volume? 5 milliliters. Go to my calculator, 600 divided by 250 times 5 equals 12 milliliters. And that is the end. Okay, and if you're having lots of troubles, please reach out to me. I'm always happy to do math with you. I hope that you found this video to be helpful and that you have a great day. Bye-bye.